This is our Carisma SC Low Profiling Nursing Bed. It profiles, it is a slick design, it's not very hospital looking, it's not clinical, very smooth edges on it, and it has very many different features that we'll get Fergal Kelly, our territory sales manager, to show us here today. It has lockable controls, it has feet raising elevation, it has profile, it has up and down features. It can go very low to 25 centimeters and also can go to a high working height of 80 centimeters.
Okay, so just looking at the features on the handset, we have our 6 usual features: our backrest and to bring it back to neutral, our footrest and to bring it back to neutral, and our bed height adjustable. So when we bring it down to the next 4, if we press the 2 buttons together, just after a couple of seconds it unlocks. This will bring the bed up into a seated position, as we'll show you in a few minutes, for somebody who needs to watch TV, our visitors are in, they're having something to eat. And also the bottom, which will bring it back into Trendelenburg and anti-Trendelenburg, if there's anybody with extra swelling of the feet or that, and they can bring the feet up over the heart rate to help with that. Okay, so we can see here that we have Olivia down in the low position, just 25 centimeters from the ground. And if I want to bring her up into that seating position for feeding, or if there's visitors, or for watching TV, it's all from just one press of a button. So you can see the backrest comes up. You see with our low footboard, it's good for visual, that it's not blocking her eyes. And we can come right up into that sitting position. Again, stopping it at any level we want. Okay, so just one of the features here that we have on the split side rails is those 4 different height adjustments, okay? Very easy to do. We have a button here on each side. So using your both hands, just press the button and we're straight up into our first height adjustment. Again, if you want to go higher, press the 2 buttons and we bring it up into the second. Again, our third one, up we come, and we bring it right up into the fourth. Okay, so we found with maybe 1 or 2 homes that just with the carers, when you release it, you don't want to push down on one side while the other side is still up, or it'll jam. So once you unlock the 2 of them together, you just bring them both down at the same time. Again, unlock together, and you just bring them down level again. And then the last one, unlock together, and then just bring them down like that.
So the Carisma is highly adjustable. It can be used with different height carers. It can be used with different sizes of people, lengthwise. You can make it longer. We'll show you here and demo with Fergal here in a few minutes. But just to start off, this is the low lying safe sleeping position. This can be used with clients that are at risk of falls. And by having the bed at this level, it reduces the risk of falling and reducing the risk of having maybe a higher injury or breakages or fractures. So it's really important that that can be put in place and clients can sleep at that lower level. Then it is height adjustable. So for your carers, for your nursing staff, and for working with your clients, you can bring it up to what they call a safe recommended level of about up to 80 centimeters. But usually for care staff, you can have different sizes of people. So usually hip level. So from my point of view here, I'm bringing it up and I could easily work with the client, help them to get dressed, help them to transfer, getting a sling on and hoisting somebody. You can get up to a safe height, hip level here. Again, Fergal is a little bit taller than me, so somebody maybe that's a bit taller. Again, the safe working height might be a little bit higher. And this bed will come up to 80 centimeters. There is an underbed clearance of 15 centimeters. Again, your hoist can fit in easily underneath the bed. You can also use your safe transferring aids like your Zara Steadies, your sit-to-stand hoist can be easily used with this bed. And also, it comes on casters and it has one-sided brake control. So just on pressing on one side, it'll do both sides of the bed, which is very handy for carers. You don't have to be going around the bed, and it's very easy to use. Here at the footboard, it can be extended longer for your taller clients as well.